Hello, our dear viewers, and welcome to our show, Diet Myths. Today we're going to be covering the part 2 of pregnancy and nutrition, and we're going to be discussing some topics of what you should not do during your pregnancy. So we definitely want to ensure a safe and healthy pregnancy and delivery, and there are some things a woman really needs to be more careful of when she's pregnant. And the first thing is, of course, her immunity. So we all know that with hormonal changes, our immunity could go down, and therefore we're more prone to getting sick. And the most popular type of sickness for a pregnant woman is foodborne illnesses. So you can get sick from the food you eat. And therefore, there are many important topics that you need to keep in mind when you're choosing food during your pregnancy. Now, the first topic I want to cover is eating unpasteurized cheeses or soft cheeses. So we know that there are a lot of cheeses in the market. Most of them are pasteurized, meaning they've been, prone to high heat and the bacteria in them has been killed off. But a lot of cheeses, and especially the soft cheeses, so you're talking about the creamy soft cheeses like brie cheese, blue cheese, feta cheese, where they may not be fully pasteurized sometimes, and sometimes not even pasteurized at all, just because this is how the cheese is processed. With these cheeses, you really need to be careful because you could be prone to getting food poisoning, and that's not something we want during a pregnancy, especially that food poisoning could cause miscarriages or other troubles in the pregnancy. Another thing you really need to be careful of is the cold cut meats. So a lot of people eating cold cut meats could be prone to a bacteria called Listeria that is already found in the meats. And if you're not careful with cooking these meats, you could contract this bacteria and therefore become sick. Now we've got a couple more topics to cover, so please stay tuned and we'll be right back. So welcome back, our dear viewers. Now, another food substance that I really want you to be careful of is fish. Now, I know you've always heard us say, eat more fish, fish is really healthy. But with pregnancy, you really need to be careful of what kind of fish you are choosing. Now, fish could be contaminated with methyl mercury, and that really has been cause problems for the baby, and definitely has caused a lot of birth defects, which is something we want you to avoid. And with that, you really need to be careful of big fish. So the amount of mercury found in small types of fish is really negligible. You don't really need to count it. But with big fish, and fish like shark or swordfish, tuna can actually grow large in size. These are the fish you need to be careful of because they could be contaminated and you could get food poisoning from them. Now, I know a lot of you are thinking of all this food, but you're probably wondering how much weight I should gain. Now, the average weight you should be gaining is about 1 to 2 kilos in your first trimester. So the first 3 months, you shouldn't exceed the 2 kilos. And then after that, you should be gaining an average of 0.5 to 1 kilo per week. So each week after that, you should be gaining weight. Now, of course, you don't want to not gain weight because that means that the baby is not developing and growing. On the contrary, you want to gain weight. You want to gain a significant amount of weight to help facilitate the growth. And we repeat again that you shouldn't be consuming more than 200 to 300 calories a day extra on what you used to consume. And even if you are someone that's overweight or obese or suffering from extra weight, this is not the time to diet. but I will give you some tips on how to control your weight in a bit, so please stay tuned. So welcome back, our dear viewers. Now, like I said, if you are worried about excess weight gain, or if you're already overweight and you want to control the food you eat, there are some tips. Definitely use smaller portion sizes, and even to avoid heartburn, which is a very common, symptom of pregnancy, eat more frequently. So have 6 small meals during the day, if that is possible for you. This way your portion sizes will be smaller and you will avoid any heartburn. Now, some people could have morning sickness, and this is where you could perhaps include some crackers or some salty biscuits. But definitely don't overdo it with portions. So only have 2 to 3 pieces, and that should be enough to control the morning sickness. Like we said previously, drink plenty of fluid, so have a lot of water. This will help curb your appetite sometimes. I know that we're all afraid and we all think that we need to eat so much, but the baby doesn't really need that much food. As long as you're eating good quality food and your baby's able to get all the nutrients it needs, you'll be fine. Another thing is, not only do you need to cut your portion sizes, but you need to also be smart with the snacks you have in your portions. So have lots of fruits, lots of vegetables, and lots of fresh ones where you're getting fiber. And again, this will help with constipation, which is another major issue and complaint a lot of pregnant mothers have. Exercise is feasible during pregnancy. Definitely do consider it. If you are someone that's never participated in exercise before pregnancy, then maybe consider something gentle like swimming or yoga. If you are somebody that used to exercise a lot before the pregnancy, you can contact your healthcare provider and perhaps you can continue exercising, but at a less strenuous pace. So I hope you enjoyed today's episode and have learned a little bit about nutrition and pregnancy and what you should really be focusing on. And we'll see you all next time.